Right, good morning. Today we're going to talk about defining a research question and developing a funding proposal and submitting applications. Some fundamental things about doing that. Again, I talk about that I come from Swinburne University in Australia, and I like to acknowledge the people, the Wurundjeri people of the Kulin Nation, because that is their land for many, many years on which our university sits. And we like to give proper acknowledgement to their elders and the ancestors that came before their elders, past, present, and emerging. The new leaders of the future, like the new leaders of the future that you are teaching. Yeah. And also thank you to the University of Parma leaders and Antonio Bonasaro for welcoming me here, and for yourselves for all the things that have made it possible for me to come. Again, I was born in Whakatane, and Whakatane is a small place on the east coast of the North Island of New Zealand, and it's quite subtropical type climate, a little bit Mediterranean type climate, and off the coast is an island called White Island, which 2 years ago blew up and hurt a lot of tourists. But when I grew up there, because it's a volcanically active area, lots of earthquakes when I grew up in that area. Two daughters and 4 grandsons, and one's grandson's coming to visit me here in Parma next week, which is very exciting. Yeah, I'm New Zealand qualified nurse and midwife. I also have Australian registration, and over the years as I've worked, I've had registration for nursing in Kenya, Uganda, the Middle East, lots of registrations. Yes. Because I believe in lifelong learning, and I also believe very strongly in maintaining practice. So I have always, to maintain practice, when I go somewhere else, have needed to get the license to practice, which is why I've had, and currently I have licensure in Australia and New Zealand. I work as a professor of nursing and also greater health workforce development and the things needed to develop the workforce. So it's a bit about who I am. So today we're going to talk about why research, why do we even do it? And what is the impetus in healthcare settings and in health professional education? Why is it an important part of what we do? And why is it part of our programs? And then we're going to talk about identifying priorities in clinical and educational questions, and turning a question into a research, and the next steps in the research process. So we'll talk about some of those things. And I'm hopeful that, I'm sure that because you are active researchers, you know quite a bit of this stuff, but you can also find some of these information useful when you talk to your students. Right. So our objectives is to increase understanding on the imperative or the basis of research, the research process and its relevance to nursing education, and its relevance in particular in safety and care. Consider some areas of research priority, and we're going to describe how to develop some good research questions, and we're going to practice drafting a research question. If we want to stop and run a bit of a workshop, and sometimes when you're teaching your students, you want them to stop and actually practice. And then we're going to talk about what they do with it if they wanted to get some research funding. So the first thing is why research, and why I always say upfront, and absolutely upfront, our culture is patient safety. That is what, our whole Hippocratic oath that everything is first do no harm. So how do we be safe? And the thing about being safe and about knowing best practice is that quality care is what we teach and practice, and that quality is made up of 3 components. The patient experience, what it's like for the patients. People didn't worry about that so much maybe in past years, but it's certainly really important now. Patient safety, that culture of safety of what we do is safe, and also what is the evidence-based practice. And yesterday we talked a bit about how quickly things change in practice and what is the evidence. I should send to you a clip I saw yesterday of an Australian firm that they are worried that since COVID pandemic, the amount of plastic gloves that is going into the waste is 4 times greater, right, than before COVID. That's all going into our rubbish. So this firm in Australia have developed a gel for a small lady's hand, 2 drops, for a big man's hand, 3 drops. You go like that. It's got the gloves. After you finish, you wash it off, right? And so these innovations and best practice are happening all the time, etc. And they form the quality of the care that we provide. And so we research with a purpose, and our purpose is to enhance quality. And for evidence-based medicine and nursing, our stakeholder experience and quality healthcare of the data that we put in. And we undertake research activity with a thoughtful analysis of data, which is essential to quality healthcare. And good morning. Come in. A really important part of all this is that the role of nurses. Nurses are quality agents who ensure the safe passage of patients through a complex health system. We sometimes don't think it's that complex, but for people that come here, where to go, what to do, who to see, the multiple people that they see, what medicines they should take, what the surgical journey is, or the medical journey is, what the rehab is, what they should do when they go home, when they should come back, who else they should see, what the experience really means for their lives, etc. It's quite complex. And at every point of the way, there are nurses who are the quality agents who ensure the safe passage of people through that healthcare system. And basically, without the unrelenting efforts of all of the members of the nursing team, poor episodes of care will persist. So this is a very driving reason of why we do what we do. Sometimes our nurses and sometimes our students say, but I just want you to teach me to be a nurse. Why do I have to do the research piece, right? This is the compelling reason, because every nurse needs to be involved in ensuring that things are constantly looked at quality, that best practices and new practices are adopted. Otherwise, poor episodes of care will continue. So when we talk about best practice and we try and describe that to our students, what is a best practice? It's a technique or a methodology that through experience, both experience and research, has proven to reliably lead to a desired result, an improved result, right? And the best practice is the best way of going about things. And for nurses, a commitment to using best practices in any field is a commitment to ensuring all the knowledge and technology at one's disposal to ensure success. So we have an obligation to make sure that our knowledge is up to date, and that that is how that we are going to ensure success. Some of these, if I just go back there, no, I think I missed one. Why am I not going back? I'm going in the wrong direction now. I'm looking to go back. Oh. The next one back. Next one back. Yeah, that's right. So just before I went off that slide, so you see the sources at the moment. At the moment, there are, if you look at those websites, a lot of really, really good resources that you can use with your students and your teaching about these topics. You'll find those useful. So it goes back to, and we've talked a bit before about your responsibility as a nurse educator for safe practice. So it's about aspects of professionalism and accountability in nursing. We teach and prepare nurses to practice safely, competently, and ethically. So every one of those graduate nurses, we are signing, and the head of school signs on a piece of paper that they've met all the requirements, that they can go out there and practice safely, competently, and ethically. That we use critical inquiry, that is research as a guide for practice decision-making and to reflect upon practice experiences. And throughout the whole programs of study, that is what we do with our students. We provide and improve nursing services in the best interests of clients, families, and the community, and displaying sustained personal commitment to ongoing learning and evidence-based practice is at the very essence of who we are as nurses, and particularly who we are as nurse educators. It is part of our professionalism and accountability in nursing. Even though sometimes late at night we find it very tedious as we're struggling to upload a paper for peer review, and we wonder why we're doing it. And what is this all in the midst of the agonies of a PhD program? It is always to go back and say, so why am I really doing this? And what is this about? Your primary responsibility relates to quality, safety, and best practice. And first and foremost, the focus on research inquiry that investigates gaps or deficits in quality or safety in the classroom or practice. And this is getting to the essence of what we should be researching and what should be the basis of our questions and where do you start. There's things out to the side that are kind of interesting or things, but it always comes back to how does it relate to quality, safety, and best practice. And the outcomes of your research endeavour should identify evidence-based solutions and recommend strategies for improvement in the quality and discovery and safety of patient care, and or educational approaches to produce graduates who are safe to practice. So there's two kind of forms of research. There's often discovery research and there's often translational research. Increasingly, nurses are involved in translational research. So discovery research, which has often been 99% of research, is discovering the latest chemotherapy drug that will best target that particular cancer. That is discovering something, right? Translational research is a lot of what we do in nursing. We look at what is a practice and how do we translate that to the ward or to patient care, or how do we translate it to the classroom. And so the outcomes of our research should be looking at strategies for improvements, translating it into either quality and safety in patient care or translating it into educational approaches to produce graduates who are safe to practice. So research is actually a nursing competencies. So quite often our students will say, but just teach me to do the blood pressure, teach me to take out some stitches, teach me how to get someone out of bed. Those are all skills, right? Versus a competency. And as soon as somebody carries a degree level qualification as a Bachelor of Nursing, a core competency is researchers and nursing competencies. And it can take all forms of audit, you know, like they go out into practice and maybe they're not all going to be educators or they're not all going to be full-time researchers, but the things that they do is clinical audit, undertaking audits, looking at risk analysis, infection control, incident reporting and analysis, patient satisfaction surveys, analysis of best evidence and trends. They're essential components of improving the quality of healthcare and reducing medical errors. And that is why your students need to understand the research process, because if they don't know how to analyse the data of the risk, incident reporting and analysis, etc. So these are really clinically focused, everyday things that happen in a health system that require research. And that achievement of excellence in terms of the excellence of a health service, the excellence of a GP practice, of a hospital, is assisted by nurses and nurse educators with an unrelenting commitment to quality and safety-based inquiry. That's how the whole system works.
Do you mean trans?
Translational research is basically, right, so if we take the incident reporting, right? Discovery research would just look at the number of people that fell in hospital, number of falls, and maybe why they fell. Translational research would go and search the literature, talk to other hospitals, and look at what are the solutions. So you've got the data, which is discovery, right? Translational research looks at the solutions and makes recommendations for implementing the solutions, and then after a period of time evaluates to see if it helps, right? So you are translating what you've discovered into practice, right? So it's all very well known as, oops, like we have a 10 or a 12% post-surgical infection rate, right? Or we have in hospital, in our medical wards with older people over 65, 10% of them have a fall in hospital. Okay, so the translational research is, so what does that mean? What are you going to do about it? What is the solution? How are you going to then evaluate whether the solution you put in place, it helped and your trend on your statistics is better? Right. So it's a difference. So increasingly, it is nurses that are involved in translational research on really practical levels in terms of, so I think of another example, you have an outpatient clinic, right? And 30% of patients on the second and third appointments are not attend, they don't come back, right? Why? Okay, it's really easy to do the discovery piece, right? And discover that many people don't come back. The translational piece is doing some qualitative work and some follow-up audit, ringing them all up and asking them why they didn't come back, right? Quite often, like in many systems with outpatients, so there's going to be an orthopedic clinic and the surgeon has the whole morning, but they're busy people, you know, and sometimes they get called to a major crash in the middle of the clinic or something. So there's 30 people that need to come in the morning to be seen. So they make them all for appointment at 8 o'clock. So 30 people come at 8 o'clock, very common, right? And they sit there day after day, and they get sick of it. So like, and then they find out a bit of information. Well, they decide they're not going to come back, but they'll waste their time, you know? So the solution is about trying to map how many and giving of the 30 people, eight of them 4 of them an 8 o'clock appointment, 4 an 8:30, 4 a 9 o'clock appointment, actually staggering because you respect your patient and you're looking at patient experience. And then basically you do that for a while and then you have a discovery piece again and you say, have we got a better attendance rate of them not coming back? It is nurses that tend increasingly to do this kind of research. Some discovery research is very easy. It is easy to look at data sets and look at your incident reporting, right? Some discovery research is exceptionally difficult, right? And you'll often find lifetime scientific researchers and lifetime medical doctors doing some of that, like the cell division between how a vaccination works or doesn't work. That's often discovery research that takes years in the lab of testing things, right? But increasingly the translational, so we're translated, I've got my tongue tied around it now, research, right, is done by nurses in practice looking at real world problems like infection rates, fall rates, risk analysis, medication errors, but not just doing the discovery, but actually translating to identify a solution by reading best practice, implementing a solution, and then evaluating. So nurses also need to be quite good at their methodology. That's a whole nother lecture in itself of evaluation research. Yeah, what makes a good evaluation model? Yeah. So some of the things, what's involved. Research about exploring, probing, reading up over, poring over, delving into, digging, constantly thinking, scrutinising the why, where and how, keeping your eyes and ears open. So rather than a nurse being a blind follower of skills, someone comes back from the ward, you take the thing, you do their OBS, you make sure that they're not bleeding, you do the things, you discharge them, come to work the next day, come to work the next day, right? Research active nurses and nurses with those competencies, they notice things, right? So for example, just trying to think about the patients that come back from operating theatre, right? And they have a clinical handover to the ward nurse, right? Okay. They often find that, say, maybe quite a few of their patients are within 3 or 4 hours, they come back comfortable, they have unmanageable pain. An astute nurse may notice that over a period of a few weeks and then might go and ask the question, so why? Right? It might be something as simple as that there is a lag between the prescription orders for the pain relief being available post-surgery for the administration of the pain relief. It could be something as simple as that, right? So nurses, as I say, they are the guardians of the safe passage and quality care. A nurse who has a research-related mind is constantly watching and thinking about things, and rather than just say, oh, well, that patient can sweat it out for another 2 hours and then the pain relief will be there. They notice things, they ask questions, and they do things about it. Yeah. Some key terms. A research question summarises the significance of the issue you will investigate. So when you're basically saying, I've seen an issue, so how do I make that into a research question? The research question is a summary of the issue that you're going to investigate. The title consists of the topic and the outcome, right? So when you're making a title, you have the topic and the outcome. So let me try to think. Telehealth practice to increase patient access in rural areas. So the title is telehealth, the outcome is what you wanted to do. So it might be examination of patient fall patterns to reduce falls in hospital wards post-surgery, right? So when you start to think, you know, often when you're writing a paper and that you're struggling about how do I make the title should reflect the topic and what the outcome was that you wanted to achieve, okay? The research problem, so when you're describing your research problem, explains the knowledge gap that will address the focus on patient quality safety. A hypothesis is if you are doing research that has an hypothesis, so some qualitative research does not have a hypothesis, but if it is a hypothesis, it's the predicted answer to your question that became tested and is based on prior research. These are just what some of these terms mean, and a research focus specifies the scope or your domain of inquiry. These are just some fundamental terminologies, but some of them are helpful, like the title, because you get the title. How many times have you done a literature search and you get the title and then you read the abstract and read the thing and it's not what it was about? Yeah, okay. However, a really rigorous journal, the reviewers will come back and make you do a title, should be quite pithy. It should be what it is about, whether it's infection control or telehealth or prevention of bed sores or you know, like, so if it was bed sores, they'd be thinking in terms of prevalence of bed sores, and then you can put a colon, and it is strategies to prevent bed sores in quadriplegic patients. Okay, is what you're trying to achieve. Okay? Because otherwise you get this frustrating, and it's things about keywords. Do you use them? I should have put that in here. Do you use the mesh browser to get your keywords, or do you just make up your keywords? You use the mesh browser, yeah. And students understand that, because if you use your keywords from the mesh browser, right, which is the International Library of Congress of Keywords, that means your work is more likely to get cited, because when people do a literature search, they use keywords. And if you made up your keywords yourself, not the ones from the mesh browser, your work is less likely to be discovered. It's just some simple tips and techniques.
We identify the mesh terms in the keywords.
Yeah.
With answering the abstract.
Yeah, so if you want to have a question and turning a question into research, it's kind of, so what is the problem? So the problem is that people come to hospital to have a hip replacement or to something or other, and then about 10% of them get injured in hospital because they fall down in hospital. So the first thing you should do is review the literature. What does the evidence say works? Is there a different from current practice? Will this work in your setting? Right? So looking at what does the evidence say? Is where you work, are they following current practice? And if not, if you made some change, would it work where you are in your settings? Is it something that was done in Slovenia, and will it work in Italy? You know, who are the key stakeholders? To fix it, who's going to need to be involved? Right? It might be you need to get the buy-in from the ward charge nurse, but you need budget people. Say, for example, you're going to put a handrail beside all the toilets so that when people go to stand up after surgery, they've got a handrail to hang on to. You have one of the stakeholders who's got the budget, and then it's the facilities people who's going to implement it. So to get your solution, who do you have to talk to? Who's involved? And then you can develop a research question. Who will work on this? And what do you need for your research plan? Because if you've found something that's a problem and you want to turn it into research, you want to have the pattern of what was currently happening, and you need the research to evaluate whether or not your implementation worked. Okay? You have your baseline assessment. So the baseline assessment is measurement before you start. What is the current infection rate? What is the current falls rate? What is the current medication rate? What is the, right? Because you need to know whether or not, and so you have to have that baseline. It's no use saying we did this and it was wonderful, and look, we've only got 10%, you know, we've only got 3% kind of like error rate. And someone says, well, what was it before? Oh, I'm not exactly sure. Like it doesn't make sense. And then the implementation, it's normally good to start with a pilot study. So these pilot studies are often things that individual nurses can do or students can do. So you start small and then you fine tune it. And then if it works, then your role as a policy influencer to be able to say, we should do this in all of the wards because they too have these problems. And then your evaluation. You measure again, has the intervention has a positive impact on the clinical problem? Was it cost effective? How are you going to ensure that it becomes embedded in clinical practice? Yeah. So that's from starting from your initial issue or your research of the process that you go through. So writing your question, identifying your research question is one of the first things to think about before your inquiry. If you haven't got your research question right, it's kind of like if you're going to build a house, right? If the plan is wrong, and if there's gaps in the plan, if the question's wrong and the plan is wrong, it comes out a bit of a mess, and you can't fix it. Sometimes I review papers for publication, and and in reviewing the papers for publication, I find that there's a flaw in the research question or a flaw in the methodology. It's really hard to almost impossible to go back and retrospectively fix it. It's got to be right up front. So if you're writing a strong question, it should be focused on a single problem or issue. Don't try and bite off too much at once. There are complex things that when years and years into the future, when you've got 1 PhD, 2 PhD, and you want to tackle something, you might try and do more than 2 or 3 issues, but typically start with a single problem or issue. Make sure it's researchable using primary and secondary sources, that it's feasible to answer within the time frame and the practical constraints. Some of those things about researchable, is it researchable? Let me think about the piece I did. So when I was in the UAE, there was a strongly held belief that Arab people, particularly Arab men and Bedouin people, so Bedouin people were the normal kind of people who had lived in tents and deserts and crossed the desert before oil came and before they had houses. There was a view that they had a poor view of nursing and that they thought nurses were slaves. And they didn't think much of nurses and they wouldn't want their kids to be nurses, okay? So Griffith University came to the Middle East, to the UAE, to help the UAE government get Emirati people to be nurses. But there was this perspective, no, we'll just get some Arabs from Lebanon and Egypt and they'll do it. This that the Bedouin people would not want. So everybody believed that. So one of the things that myself and one of the Arab Emirati heads of nursing, I said to them, has anybody ever asked Bedouin people? How do you know this? I said, do you even speak the language? How do you know? Okay. So we thought we'd go and ask them. So the first thing is it researchable? Do you think they'd talk to us? Right? And if they could talk to us, could they understand us? And so that whole thing, is it researchable and is it feasible? Right? So the first thing is that if I decide that I'm going to go out and talk to some very traditional Italian elders or very traditional Emirati people, Bedouins in this situation, and I'm going to be the researcher and I'm going to, but I can't speak their language, but that's okay, I'll take a translator with me. Do you think they will really tell me what I need to know? Do you think that they will feel comfortable and safe and translate what I need to know? Do you think that they will share their thoughts honestly? Probably not. Okay, so we did this piece of research and it's published, right? And it's cross-cultural research. So what we did was we worked together and we went up to one of the local clinics that was out in the El Gabria region in a remote thing where there was lots of Bedouin, very traditional Bedouin people, right? So we asked some of the nurses there if they thought they could go and talk to the Bedouin people and they were interested. But they had never done research before and they had never done qualitative interviewing before. So the Arab-speaking chief nurse, he ran workshops about qualitative interviewing and how to ask questions without leading people and not getting the answers and how to do that, right? So we went out, the data was all collected in very traditional Arabic with that kind of, I'm just trying to think, dialect, right? So then we got the scripts and they're all in Arabic, but I speak English and we were going to publish in English. So how do we know, right? So then we tried to get a translator. So the translator couldn't translate it because they didn't know Arabic. They didn't know English. They knew Arabic, but they didn't know English. Okay, so I had these scripts. So what was I going to do then? So we went to Saudi Arabia, right, over the border. And we found a researcher there that was fluent in English and fluent in Arabic, right? So they translated the scripts to English, right? Okay. So then with those scripts, you had the Arabic version. So we went back and we said to the Arabic-speaking nurses, he translated to an Arabic version and an English version, but there was a difference in dialect. So we had to go back and say to the people on a second visit and take it back and say, this is what we understood you said. Is that right? And they said yes. Okay, so this question about, is your question researchable and feasible? You have to think about who you're going to talk to, what language, how you're going to get the information, whether they trust you enough to talk to you, whether they will tell you, whether it is feasible, how much it is going to cost. Now, this was very expensive. So when we had our transcripts first, there's an online thing called Way with Words, right? So basically it was, I'm just trying to think of the price, about $10 US to transcribe per page. Okay, so to take the tapes and transcribe it, it was $100.67 per word to translate it. Extraordinary. Now, it cost us $2,500 US to get the guy in Saudi Arabia to do what was going to be a $20,000, $30,000 job, right? But then we had this issue about dialect and we had to check it. So we checked it. And guess what our findings were, all right? Bedouin people don't think nurses are slaves. They think nurses are wonderful. And the key reason is that they said nurses are the people that we trust. Nurses ensure safe passage. When we go to the hospital and the nurse is there and can speak our language, the nurse is there with us. The nurse explains what the doctor says to us because we don't always understand. We feel safer with our nurses there, and we would feel proud for our nurses, our daughters to be nurses. Entirely different from what the perception was. So the research was worth doing, but it's probably some of the most complicated research that are doing. If you're going into the foray of transcultural research and all the different languages and all the different life bits, it gets right at the heart of the question. Always ask, you have a good idea, you have an issue, how are you going to collect the data? Is it feasible within the time frame? Can you actually get to the participants? Will the participants talk to you? How much is it going to cost? Have you got enough time frame, and what are your practical constraints? All right? So if your students decide that they are going to talk to people, or you're going to do community-based constraint, are you going to get the people to come into you, or are you going to go out to all the villages and talk to them? And have you got the transport, etc.? Those kind of things. And then, is your question specific enough to answer? Is what you're doing specific enough, your question, to answer what the issue is? But it's complex enough to not just gloss over it. You know, you actually have to ask sufficient questions that you can get to the nub of the issue. But the question you have to answer so that you also understand the complexity, because quite often what you're trying to solve is quite complex. So if we go back to, say, the example in the outpatient clinic, right? You can basically be really simple and just ask them about the irritation with all being scheduled. The scheduling, was that a problem? But there's lots of other things. They might have been, they might have the transport. They haven't got a family member to bring them. It costs too much. They haven't got the money to get there. There can be a whole lot of complex things, so that if you don't ask the right question, if you make it too simple, you won't get to the answer. You will end up saying, okay, well, it was a scheduling matter, you change the scheduling, and then 3 months later when you do the evaluation, you find there's still the same amount of no-shows. It didn't actually help anything. So you've got to get that mix between being really specific to answer, but being complex enough to answer. And it has to be, the questions need to be relevant. And then there's a piece there at the moment, if you click that link about writing strong research questions, and there's some criteria and some examples how to write them. And it's always important so that you get that question right, otherwise you get to the end of a master's or a PhD thesis, and if you didn't get your question right, the examiners it's not a happy story. Okay. Start with what you can manage and what is appropriate to your educational and or clinical role and context, right? And also look at that applied or that translation research versus theory building. It's nice to kind of think about that you're going to be Einstein and you're going to come out with a theory of relativity. But when you're starting as a researcher, Don't start there, right? When you get to your PhD, you're supposed to generate new theories and things like that. But for your students and for your initial research, start with that applied, with that translational research about improving quality of care, improving patient care, avoiding patient harm, and improving professional practice, and also improving your educational practice. Focus on your role as a nurse educator and a clinician. As I say, no one expects you to be Einstein when you come out. So, you know, like, it takes, to build a good profile on Google Scholar, to build expertise in getting accept in your publication submissions in Q1 journals, it takes 10 or 15 years. Start small, build your successes on. You start with things that are contextually relevant locally versus the globally generalized solutions. So, you know, it might be nice to do a study on prevention of medication errors in Europe. But really, you know, again, that feasible, how are you going to get all the data from all of the major hospitals in every place in Europe, right? So start contextually relevant local, where you can get the data, where you can get the access. And then when you've done that well, you can find a collaborator in Switzerland who can replicate, and then you can join it together. Then you can do a publication on comparative findings, right? So as you build your career in our country in terms of, so you have a level B academic, which is a level B is a lecturer, a level C is a senior lecturer, a level D is an associate prof, and then a prof, right? So at level C, you are expected to be a local researcher. Associate prof, you're supposed to be a regional in your region across Italy, maybe some of the European region, right? And a full prof, you're supposed to be able to start to demonstrate that you are internationally active. Some of the things that, you know, Antonio's just published that paper with us in terms of etc. But when you're starting out and when you're early, is get lots of practice on local stuff in high quality journals that build your expertise on research questions, writing, delivery, submission, build up your number of publications, build up your number of citations, and then if I go back through some of my stuff, and I did things in the UAE and went to Australia, went down to New Zealand, there was people in New Zealand who wanted to do a comparative study with what was the same issue like in another country, yeah? And that's where, when you start going to conferences and things like that, you keep your eyes and ears open. Say if your area is infection control, or if your area is in falls prevention or things, you find people doing similar work in another country, start to make them your best buddies, start chatting to them, because that's then how you start to then build in terms of spreading out from national to regional to international research. Yeah. And as I say, it's a journey over 10 to 15 years. It's not something you can just wake up and say, well, tomorrow I'm going to be a full prof. A lot of hard work over time. But there's systematic ways that if you think about what you're doing, that you can do that. Some of the questions, lots of questions about safe practice, curbing hospital infections, identifying patients correctly. Do you all know about the JCI, Joint Commission International 6 International Patient Safety Goals, right? So your JCI 6 International Patient Safety Goals are really important, and they are the stem of many, many questions. And when you start to look for collaborators, like, so across all of America, across all of the Middle East, the hospitals are JCI accredited, and they're all focused around the 6 International Patient Safety Goals, which are prevention of infection, safe clinical handover, preventing falls. Goodness me, my mind's gone blank, but there's 6 of them. right? And these can be, so avoiding hospital areas, preventing thromboembolism, you know, that's all about patient mobility, post-birthing and post-surgery, assembling better teams and rapid response systems, sharing data for quality improvement, fostering an open communication culture, best practice and clinical competency assessment. Like the other day, we talked about OSCEs as clinical. What are the best practices in OSCEs, you know, and fostering collaborative learning. So there's things that fit in the educational field, hundreds of topics. When you start to build a topic, again, as you build your career, you're basically saying, what is your specialty? You can research all of those, and in 10 years' time, they'll say, well, what's your research expertise? It's kind of jack of all trades and master of none, you know, are very scattered. So it takes a little while to think, you know, what am I really interested in, and where will I build the expertise? But these are lots and lots of ideas of where you can start. Right. Here I've got the JCI patient safety goals. I had put the slide in there. So identifying patients correctly, effective communication, safety of high medication alerts, correct site, correct procedure, correct patient surgery, chop off the left leg when it's supposed to be the right leg is not helpful, reduce the risk of health-related infections and patient harm from falls. So, you know, the falls things, you know, like I can remember when I started nursing, and is that you always had the bed rails and you put the bed rails so they wouldn't fall out of bed. That is really a bad thing now, because a patient that's a little bit confused or a little bit demented or anything, or post-surgery or had things like that, they then get up over the side and it's further to fall. So the prevention is not having the falls, but putting the bed right down to below, you know, and then etc. So that's how practices change. Yeah. So are you teaching these in your program? Are your research concerns about any of those JCI things, quality factors in your ward or your unit in terms of, and these also form lots and lots of things about, you know, your student thesis, of what your students can be thinking their thesis about what basically they should focus on. The preparation of graduates, read the foundational concepts of quality care, including human factors and organisational priorities. These all form good, you know, research questions. The use of evidence-based strategies for improving the quality of care, the role of nurses in quality care provision, implementing models of patient and family-centred care, educating and empowering patients in care, developing culturally appropriate models of care, etc., and use of data to guide decisions. Right? There's 100 things you could put on that list that are basically, that could be a student thesis or a research project to a problem that you're going to look at. So when you start with your research question, there's some good words. What is the nature of? How did it differ from this? What are the functions of? How do you affect, or, you know, what is the effect of narcotics? The use of, what is the effect of post-surgical narcotics on the incidence of patient falls? You know, what is the effect of fractures in the elderly on the incident of medical delirium? You know, how are so these are just good stems to be able to use to start a question. This leads into, usually when I do this workshop, is then if I've got students, I then can, over 2 or 3 lessons, you can get them to start practicing a question. You can pause what you're trying to teach them, get them to practice a question, and then come back to you with the questions. Oops. Drafting a question, so as I say. Yes, keep calm and form the, yeah. So usually I say this, say we break the session and okay, let's stop for 20 minutes and let's see if you can draft a question on something that's bugging you, right? So it's, as I say, I will give you these slides so you can use them as a tool when you're teaching your students, and you can, helping hand washing helps to prevent the spread of known soap questions. So the question can be, is the use of soap and water or alcohol-based rubs more effective in preventing infections? Can be a question. Okay. It was interesting when I was in the Middle East, because they, Kingdom of Saudi Arabia, UAE, Qatar, they're dry countries, so alcohol is forbidden, right? So a lot of the nurses said we can't use alcohol hand rub, they wouldn't. So there needed to be a lot of research to basically show that alcohol hand rub was not being absorbed and was not a breach. Yeah. So it's interesting how different settings make different things. So hip fracture is common in elderly patients after falling. If an elderly patient exhibits an unsteady gait, so would a hip protector be a useful preventative measure for a patient? It's a question. Okay. Yeah. In children with cancer, what are the current treatments in the management of fever or infection? Doing a literature review around that. So it's just taking that previous slide with some of the starters of a question and how you can actually translate that to an actual question. Very specific on a specific topic, a single issue. And then from there is it, okay, I've got the question now, how to research it. Okay. So the workshop activities that I won't subject you all to that in a minute. You can work in pairs, draft 2 questions, 1 each, identify a clinical issue you'd like to improve within your program, ward or unit, choose your issues from the JCI or NHS or the National Health Service the British National Health Service Safety Checklist. JCI stemmed out of America. Draft your research question, discuss and refine your question with your colleague. Then 30 minutes, you can present your questions to the group. In 20 minutes, then you can have a group discussion with everyone about what was the best question. So what I've just given you is a lesson plan of what you can do with your students as they start to think about, I noticed all those thesis that they're doing. You can use some of these things to help them decide what their question is in the first place. Yeah. So then, a lot of what you can do, many people say, I haven't got any funding, so I can't do research. That's nonsense. Most of my research comes out of your own resource of what you can do with your time or students while they're studying. However, the expectation too is that the universities is that their top researchers bring in research funding. They expect you to do that. Yeah. So it's kind of like, how do you do that? So if you're ready to apply, these are absolutely critical things on a checklist that you need. Yeah. First of all, is your question clear? Is it absolutely fundamentally clear? We've talked about some of that, and you can test it with your colleagues, right? So it's no use putting something in and they're not quite sure what it is exactly you're trying to do. Then the other important thing is, can you speak to the existing literature? Because funders will not give money there's plenty of already out in the field, that everybody knows that, right? Is your manager and your organisation supportive? That is critical. That goes back to the issue of feasibility. If your manager's not supportive and you can't get access to the data, etc., yeah. Is the project feasible and doable within your existing workload? Have you got a team in place? Do you have a project plan? Is your project aligned with the funding criteria? So, you look at what the criteria for that call is. Do you understand the costs, and have you actually done the budget? Right? And the budget is that many research funders, they expect a 50% contribution from the organisation, right? So that goes back to, if your manager and organisation supportive, otherwise where are you going to get the other 50% of the money? Have you got left enough time to apply for the due date? So at the moment in Australia, we have ARC, Australian Research Council, grants, which are a collaboration, but they're linkage grants between industry and academia. And I want one of those to expand the work we're doing until we've done all the, can we speak to the existing literature? Yes, we've done the literature searches, we're publishing, we can show the gap. We've got the clear question, we're up to there, right? We now have to have a supportive organisation, and that has to be an industry linkage organisation. So I need to talk to Northern Health, who's got 8,500 employees and there's massive budgets. Is this important to them? And if I can get 3 million, will they match it in terms of over a 5-year period? You know, so you have to go to that point. And so I have to have a budget that really details the costs, and the costs are reasonable. It's no use saying, well, I need $100 for each, or €100 for each qualitative interview, and they'll say, what? Like, you know, so you've got to really go down there. Have you left enough time? So this IRC grant, the next round is due on the 15th of May. I've said to my team, no, we're going to go for the November round, because I'm here. I've kind of got 90% of it done, but I'd rather wait for the next round than actually put something in and then got knocked back. So have you got enough time? And the other thing is, do you have a mentor or a peer reviewer? So I have mentors and peer reviewers. So I've got a paper that I'm going to load up for publication over the weekend. But I've got it out with 3 peer reviewers and mentors are reading it. They'll have a go at it before I even upload it, right? They'll come back and they'll say, this makes sense, this doesn't make sense, you've got a gap here. So, you know, have a bunch of trusted colleagues or mentors that will actually look at it before, or your research office maybe. And do you have referees and proof of your experience, right? So and that links back to, is your team in place, in terms of, it is unusual to be able to get a grant totally in your own right. You can on small grants, like €1,000, €3,000. Small grants, one person can do it. But as soon as you go for something bigger, they look at the expertise and the track record across the team, because it's like going to a bank and you're going to them and saying, we want you to give us some money, right? So they have to have the confidence that if they invest €500,000 or they invest whatever, that you're going to deliver, because they are accountable for the money that they've got to give it out. They need to know that you're going to be able to deliver. So that's where you have to have good referees and good support. So getting ready, gaining the organisational support. Select your research team. Now, I have a situation of a young man that I'm mentoring, right? And he's doing really well. And it's interesting, he came from Bangladesh, right? Came to Australia. He was a vet, right? You know, vets that look after animals that are, you know, sick. Qualified vet, doctor, you know, got the title. He got to Australia, they didn't recognise his qualifications, okay? So he decided to go and do a PhD, and he did, with PhD with scientific researchers, and they were publishing well in the Lancet, getting some things, good work. But still, it was hard to get a job. So he decided to go and do graduate entry nursing. And now he's a double doctor as a vet, a PhD, and he's got a master's in nursing practice, and he's been nursing for several years, and he's becoming a lecturer, right? And his specialty is very scientifically focused because of his background in science and as a vet, and particularly in infection control. And at the moment, he's doing a piece of research on, you know, when you put a lure in for somebody in for an IV, and they take the IV fluid out, but they leave it there because they're just going to come and put, you know, they're just going to put an antibiotic in every 4 hours. They don't need the IV fluid anymore, but they've left the IV line in the patient, right? So it's just capped, right? So every 6 hours, the nurse comes and caps it, wipes the top, and puts the antibiotic in, puts the cap back on. And they're going to do that for a couple of days. First of all, they flush it with some saline, right? But then they wipe it. So he's doing research around infection rates versus what they're using to wipe the end of it before they put the injection in, okay? It's good research, it's good clinical research, it's good scientific research, it's important. JCI infection, you know, JCI patient safety gold about the prevention of infection. So this is good. So in getting his organisational support and getting the research team, and he's a level C. There's a level D researcher in the team, an associate prof, okay, who has not been very good in getting many publications and has not been very successful in gaining research dollars. So this level D comes to my person that I'm working with and says to him, Dr. Naheed, you're applying for a grant. I want to be on your team. Okay? He looked at the CV, and this guy is a pediatric nurse that's never done anything in infection control and has not been doing any publications for 2 years. So Dr. Naheed, who was a level C, is feeling a lot of pressure from this level D. So he comes to me as his mentor, and I said, what shall I do? And I said, you say no. And I said, if you need to, you go to the support of your manager and you say no, right? And you say no because if on this research grant you apply, they then say, we've got 3 people here, okay? And they look at the CVs and they say, have we got the confidence to give this money? Have these people got the experience, the background, the prior publications? Here's level C, Dr. Naheed, lots of scientific presentations, including good collaborations with top scientists, publications in the Lancet, and someone sitting on here that's had no publications for 2 years. And so sometimes you have to be tough. Sometimes it's hard. Sometimes you get pressured. If you put people on your research team that are not aligned with your research area and do not add expertise and competence to your team, you just about guarantee you will not get that research grant, okay? It's a really valuable lesson, and in university contexts, and sometimes some of the higher level professors put a lot of pressure on, and it's not fair, right? And it's these grants are often, like particularly, sometimes the allocation for grants internally in a university, it's political. And, you know, that person that comes on might have political connections and it might help you. But I tell you, if you step out of your country and you go to Wellcome Trust or European funding or you go anywhere, they look with absolute scrutiny about the track record of who's on your research team. So you need to get the support of your organisation. And this is somewhere that you have to navigate the politics, right? You have to select your research team, be very, very careful. You particularly if you are a level C or still associate and not a full prof or something like that, you want someone on your research team that's going to help you, that's going to mentor you, that's going to respect you. And that sometimes what I have seen is that you do all that work and you do get the grant, and then someone says, well, I'm the professor, so I'm first author, but you did all the work. Sometimes you just, you know, watch out for yourself, right? Form good collegial relationships, form respectful professional relationships, and be certain about your question, your organisational support, your research collaborations, and establish supportive collaborations. And then together, you do the existing literature. The other thing too is that if you put someone on your team that's been struggling and had nothing for 2 years, what does that tell you about, are they going to work when they come on your team? Or are they going to leave all the work about doing the literature research to you? Is it you going to be working at 11 o'clock at night? Or is it that person going to be working at 11 o'clock at night alongside you helping a team? You're putting together a team, all right? Access, mentoring and support. I still have mentors, right? I look at where my support is. I have people scrutinise my work, put red lines through it, help me, tell me my blind spots, what can't I see, right? and then explore the ethics requirements. Quite often, when you go to apply for a grant, they want to know with confidence that you've got a good team, that you're going to deliver within the time, right? If you've kind of got a good question and a proposal, but you haven't yet submitted for ethics, they might say, oh, ethics is going to take 6 months or 9 months. We don't think they can do it in the time. Having ethics approval is not an absolute requirement, but it often helps. It shows you're ready to go, right? Yes.
What about the ethical board in Australia?
Oh. And all my academic life, all right, there's two things that are truly horrible. Okay. One is sometimes dealing with various journals and the research process and the publication process, and like sometimes I've submitted and I've had something stuck in submission for 9-12 months and they haven't got back in a peer review, and you get it back and it's updated and you've got to, like we've all had good experiences with journals and we've had horrible experiences with journals. Some ethics boards are truly horrible. Some of them, like the job of an ethics board, right, is to make sure that your interaction with human and animal subjects, whether it be mice or rats or mice or dogs or monkeys, but with people, and then particularly vulnerable people, like vulnerable people with mental health disorders, people, children, people who've been abused, that your research is respectful and that those people are not coerced, that you're not doing anything that's unsafe or unethical or anything like that, right? That's their job, and they've got to be rigorous about that, and there's very high international standards. Sometimes they get into like the methodology to beyond what their scope is, right? So they have a role in looking at the methodology because bad science is unethical and wastes everybody time and it's bad practice, right? But sometimes, and particularly like I've been dealing with a research ethics committee that's attached to a large trust that's got about $1 billion in it. And to date, their research has been just about pure scientific discovery research, right? They are being quite unreasonable about, they don't think that you should give ethical approval for qualitative research.
You to present the protocols. Do you normally use some tools or models?
Well, so far I have avoided AI. I know the principles and I write them myself, right? You can now do it with AI, but again, be really careful, okay? Because there's AI systems that are inside a university that are closed systems, right? But there's AI systems that are in the public domain. So for example, I have seen some tools with a literature review. You can upload, say you've searched 4,000 papers and you come down to 30, 31. You can upload your 30 PDFs and then you can ask the question. So you know how on those 30 PDFs, you have to do the analysis of looking at how many participants, how many this. You just say, how many of them were, let me think of a question, participant profiles, right? So how many participants in each study, what method was used, which country did the study take place. Press a button, 2 seconds, you got your answer, boom. Hours of work, done, right? But what you have just done, if it's not a closed system, is that all your screening, all your hours of work to find those 31, you've put them out there in the public domain. Whoever's running the AI has got your results before you've even finished the analysis or published them. Be really careful. It might be tempting to save ideas, but unless you know a lot about that AI tool. So at the moment, I'm still a bit old-fashioned. I'm not trusting enough. I do the hard yards and I do the work myself. Yeah, I still need to know more. I'm learning in that field, that AI thing. AI is coming, and we are teaching our students in our university how to use AI safely and how to declare it and but it needs to be within a closed internal system that is not part of the open web. Otherwise, you have uploaded everything that you've done is no longer your IP. Yeah, very, very tricky. Right, let me just press this. So your support is essential. You need management support. And if you decide with your students that you're going to do about something about hospital infection rates, you need clinical support. You can't start over here as an academic if you haven't got the clinical support and they won't let you have access to the data. No. And you need the mentoring and advice. Yeah. Your research team, a bit more about this, and I've done a whole slide about this because I'm so passionate about this, because if you get this wrong, it can cause all kinds of problems like we've talked about. Someone with a shared interest in the topic, someone who will work well as a team, who's passionate about quality and education and practice, represents nursing expertise in the multidisciplinary team, has some prior research experience in the area. So I'm always, because I like to do a lot of capacity building, I always have an early career researcher on my team, because otherwise how do people learn? If professors will not involve an early career researcher, how do people learn? You've got to have the opportunity, right? So I have that balance between enough expertise on my team that's credible to the funder, but also can demonstrate commitment to an early career researcher, but an early career researcher with an interest in that field, not just some random, yeah. And people who are available to attend team meetings. Really annoying when you've got somebody on your team and then 99% of the time they're no-show because they're busy. Yeah. And once you become a full professor and you're doing international trip, you've got to have a commitment that people will walk around different time zones. You know, otherwise, I'm too busy, I'm not available, or it's my middle of the night, or I finish at 6 o'clock, or it doesn't work. Okay. Yes.
It is how we can maintain passion in research that is very vast and skilled a lot.
Yes, how do you maintain passion?
And we system has this stress, I think, that you need to publish an article and search with your curriculum. It's something that is you need hard work and also a lot of time. But also, I think that maybe sometimes we lost the meaning of what we are doing, only because we had to do it. So I approach this system because I mean, approach to research because I really fascinated that. So sometimes.
Yeah, so that question is actually at the hub of one of my next presentation about what it means to be academic, right? So first of all, about being passionate, it depends on your mindset. Some people are very happy to come to work and do the same thing for 20 or 30 years in the best way possible, and that is satisfying to them. There's others of us that are either blessed or cursed, I don't know, with brains that constantly inquire, constantly think. If you're one of those kind of people, doing a standard routine job, you will not be satisfied, right? And there are some people that want to be a really good nurse in a geriatric ward on a shift basis for all of their life and be the best they can be. That's fine, right? But you are probably here because you have a brain that's, okay, that you want to teach others, you want to do it, right? Now, the role of an academic has got these multiple things. You're a teacher, you're an administrator, you are a researcher, you are trying to run your own life, you are everything, right? And the pathway to academic excellence is long, right? All I can say is that, first of all, you want to do it, right? But then you've got to look after yourself. You start small, right? The pressure is always there. Worry about it, but don't worry about it. Do what you can, what is reasonable. You start with one paper, something you're passionate about. Don't go into areas, if it doesn't interest you, the passion will die. Something that really interests you, that you believe can make a difference, right? You do one paper. You work with other like-minded people. Surround yourself with people who are equally passionate. Find yourself mentors and recognise that it's a cumulative journey built over time, right? And that you have to have a life in the meantime as well, right? I'm a mother, I'm a grandmother. I like to sew, I like to quilt, I like to go out with friends, and I do crazy things like sometimes I write till midnight and work too many hours. But you find your own balance and your own momentum in that. Because if you dwell on the constant pressure all the time, it's not enjoyable. You might as well go do another job, right? So start small. Realise that, you know, you're not going to be an associate prof or a full prof tomorrow. And you don't need to, and you don't need to be. You don't need to be. You need to do what you can now. And you also guard your time preciously in terms of, because in academic circles, there's lots of busy work or other things you can get drawn into that makes no difference to what you're going to outcome, right? And the other thing is, it's really easy to think, I'll get there faster if I'm on 5 projects. Don't. It just makes your time like confetti. Do 1 or 2, publish it, build on that. Form relationships, form collegiality. If you have far too many, you don't have time. But also recognise that it's not a life of coasting along. If you have that personality, you do a different job. And I don't think you have those personalities. People say to me, are you going to retire? Right? Yeah, kind of, but probably not. Yeah, because I like gardening and I like sewing and I like my children and grandchildren, but my grandsons are all 5, yeah, and I do things, and I like Netflix, but like, what do you do with your brain? You just, you know, so I think that is why you're here, because you have a brain like that, and you use it, but it's to say you don't have to be Einstein and full prof to begin with. It's a journey over time, yeah. Otherwise, you burn yourself out. Yeah, and you have collaborators, right? It's really easy to become just inside the university. You need to collaborate with the people in service, the people in education, and the people who are researchers. Yeah, that's how you make your good teams. And find the people that give you energy. Find the people who, and you have people to talk to, right? But you also don't want to be with somebody that talks all day and you get no work done. So, you know, you find out what is good for you. Right. You need to be familiar with the existing literature. So as I say, you know, we're going through now some of the steps in terms of your question, your team, the literature. Okay. It is no use applying for a grant if the literature is full of the answers to the question you think you're going to ask. Then they're not going to fund someone to go and do a piece of research when 10 people have already done it. So you have to know what's there. Yeah. Ethics clearance, quality enhancement inquiries. So if you're doing a quality enhancement inquiry, and you know what a quality enhancement is versus empirical research. So quality enhancement might be a clinical So you want to do an audit of, in 1 year, what was the hospital infection rates, or in 1 year, how many times did the blood supply in the blood unit get low, right? They didn't have enough for transfusion, right? You might want to do that. There's no human participants involved in that. You're working with secondary data, and so you may not need ethics. Although some journals, you've got to be, that narrows where you can publish quality improvement, right? And you can't take your findings to the next step with asking people. As soon as you start asking people and reporting asking, you need ethics, right? So that's the difference. But all, in capital letters in bold, inquiries involving human subjects, people, requires ethics approval. And existing ethics clearance means you're ready to start. It can help if you've got to that stage. Yeah, and then you get some funding for it. Final checks of your application, right? Is your research question clear and the significance of your study clear? And as I say, give it to someone else to read, get other people to read it and say, you know, are your objectives realistic and are they measurable? Is your literature research complete? Is the proposed methodology appropriate and feasible to answer the question? Is your timeline and your budget realistic? Have you addressed the ethical issues? Have you got organisational support? Have you adhered to the formatting requirements? It's like submitting to a journal. Like I'm doing a funding application at the moment, and it's online, and they've got the boxes. 250 words there, 350 words there. And if you've got 351 words and you try and proceed to the next section, you can't. You know, it's what are the formatting requirements? Have you had it proofread? Is proofreading for errors complete? I never see all of my own errors. You know, I actually have to get someone else to look at it. Or if there's not someone else, put it aside for 2 days. Don't look at it for 2 days if you've got the time, and you pick it up again and think, oh, that sentence doesn't make sense. What did I mean there? Or that you pick a spelling error, or you've left an S off the end of it. You know, are all your references and citations verified? Right. So if you're using DOIs, which you should do, and your web links, are they live? Have you tested them that they actually work? Right, because, and have you sort of sought peer feedback and review from your mentor? And if you've done all that, you're probably ready to submit and try and get some money. And it's doable.
And the way we'll have on you.
Yeah. That's it for today.